All right, welcome. Today, we're basically becoming detectives, and our crime scene, it's one of the most complex places imaginable, the human brain. We're trying to figure out what's gone wrong when everything suddenly goes sideways. And let me tell you, the stakes are incredibly high, and the clues, well, they don't stick around for long. So, picture this. Someone just collapses right in front of you. It looks like pure chaos on the outside, but what you can't see is the silent, critical battle happening inside their skull. That's the real mystery we have to solve. What exactly is attacking the brain? In any good detective story, you always start with the usual suspects. And for brain injuries, it's no different. We've got three main culprits. First up, a stroke. Think of it like a plumbing problem, a blockage or a leak inside the brain. Then there's traumatic brain injury, a TBI, which is caused by some kind of external force. And finally, there's altered mental status, or AMS. That's kind of the something else category, where problems somewhere else in the body, like low blood sugar, is messing with the brain. And this quote right here, it really gets to the heart of what we're talking about. It's so easy to think that stopping to assess someone is just a delay, that you should just be doing something. But in this case, the questions you're asking, the clues you're picking up on, the patterns you're starting to see, that is the treatment. It's the absolute first, most critical step you can take to save a life. Okay, so let's get into it. Our investigation really kicks off with understanding what a brain under attack even looks like. And the very first thing we have to do? Gather clues from the scene. So before you even get to the person, the scene itself is practically screaming clues at you. Was there a big car crash? That points you towards a TBI. Or was there no trauma at all? That might suggest a medical issue. What are the witnesses saying? And this one is huge, especially for a stroke. When was the last time anyone saw this person acting totally normal? Every single detail matters. All right, now you're with the patient. There are three things that are totally non-negotiable for the brain to survive. We call them the ABCs: airway, breathing, and circulation. Look, if the brain isn't getting that oxygen-rich blood, nothing else you do is going to make a difference. These have to be your first priorities, no question. And here's the crazy part. Here's why this is so important. The brain, right? It's only about 2% of our body weight, but it just hogs 20% of our oxygen. It's an energy monster with basically zero reserves. So any interruption to that supply, and I mean any, starts causing damage in a matter of seconds. That's just how fragile this whole system is. Okay, so with those absolute basics covered, we can now start digging for the specific clues we need to finger our first suspect. Let's kick things off with suspect number one, stroke. And if you want to understand just how urgent this is, you only need to hear one number. During a major stroke, the brain loses almost 2 million neurons every single minute. The clock isn't just ticking here, it's absolutely screaming at you. So, how in the world do you spot this thing quickly? Well, there's a really simple tool called the FAST test. It's just a few quick checks. F is for face. You ask them to smile. See if one side droops. A is for arms. Have them hold their arms out. Is one of them drifting down? And S is for speech. Can they say a simple sentence without slurring their words? These little tests can give you a really clear signal that something is seriously wrong. And all this points to what we call the stroke signature, the pattern. First, it happens all of a sudden. The person was totally fine just a few minutes ago. Second, the problems are focal, which is just a fancy way of saying they affect one specific side of the body. And maybe most importantly, there's no sign that they got physically hurt. So there you have it, our first pattern: sudden, one-sided, and no injury. Got it? Okay, let's move on to suspect number two. All right, suspect number two, traumatic brain injury, or TBI. Now, this is totally different from a stroke. A stroke comes from the inside, right? A TBI is all about an external force. Think a car crash, a hard fall. That rapid stop makes the brain literally slosh around inside the skull, and that motion can stretch and tear those super delicate neurons. But here's the thing that makes a TBI so tricky. It can be really deceptive. It changes over time. Right after the impact, you might just see a little confusion, maybe they can't remember what happened, but then hours later, that can morph into some really serious, life-threatening red flags. We're talking unequal pupils, vomiting over and over. This is a suspect that can absolutely hide in plain sight. So the key takeaway here is huge. A single assessment? That's just a snapshot. A single frame in a movie. To really truly understand what's going on, you have to look at the trend. Are they getting better Are they staying the same? Or are they getting worse? It's that pattern over time that tells you the real story. I mean, look at this example. It tracks a person's score on something called the Glasgow Coma Scale, which is just a simple way to measure their level of consciousness. 15 is a perfect score. So at 2:45, they're alert, a solid 15. But then, just 15 minutes later, they're confused and their score drops. 15 minutes after that, it drops again, and they've started vomiting. This documented trend, man, it's undeniable proof that things are going downhill fast.
And that right there, that pattern of getting worse after an impact is the classic signature of a TBI. Okay, on to our final suspect.
Our third and final suspect is called altered mental status, or AMS. You can think of this as the something else category. A lot of the time, it's not a problem that starts in the brain itself. It's a problem somewhere else in the body that's affecting the brain. We're talking about things like low oxygen from being at high altitude, getting way too cold, having low blood sugar. It could even be a weird reaction to a medication. Now, the signature for AMS is way different from a stroke. Instead of that sudden one-sided problem, this is a global issue. It affects the whole brain all at once, and it usually comes on kind of gradually. But here's the most important part. It's often reversible. If you can figure out the cause and fix it, like giving them oxygen or some sugar, you might see them get better right there in front of you.
So, that's our third pattern, a gradual, whole brain issue that you can often fix. Okay, we've met our three suspects. Let's bring this all together and crack the case.
This right here is like our lineup, the final verdict. Let's review. A stroke? It's sudden and one-sided. The big priority is getting to the hospital, fast. A TBI happens after an impact, and things can go south, so the priority is to stop any more injury from happening. An AMS? That's gradual and affects the whole brain. The goal there is to find that reversible cause and fix it. See? 3 different culprits, 3 totally different patterns of behavior. So after this whole investigation, what are the big takeaways? Well, the main principles of care are actually pretty simple, but they're incredibly powerful. First, give oxygen to anyone you even think might have a brain injury. It can't hurt, and it might help a lot. Second, trend everything. One data point just isn't enough to go on. And probably the most important rule of all, when in doubt, get them to a hospital, period. And I want to leave you with this final thought, because it's pretty empowering. Look, you don't have a CT scanner in your back pocket. Of course not, but you don't need one to start the investigation. The brain is constantly broadcasting its status. You can see it in someone's speech, their movements, their pupils, their level of consciousness. The real key is just learning how to read those signals. Because once you learn to read those signals, you stop being just a bystander and you become a detective. You can spot the patterns we've been talking about, you can identify the most likely suspect, and you can start that crucial process of care long before that person ever sees the inside of a hospital. The clues? They're all there. The only question is, are you ready to see them?